So a lot of people who travel to see us want to know whether or not we can help them with the arrangements, flights, hotel stays, all the different things that are needed to make their stay with us comfortable. We see roughly 50% of our surgical patients who come in from out of town, they fly in, and we're very well versed in this process. Our office manager and our patient coordinators have this entire process down where they will ask you specifically what type of accommodations work for you and your family, and we have a number of different type of opportunities for you. One of the easiest ones is, of course, the hotel room that is literally right next to our practice, and many patients that take advantage of that. Other patients who want to have kitchens and facilities, we have arrangements for them as well. So we will take care of you 100% of the way. That's an easy process. Morpheus 8. What do I think about it? So just recently I did a full exploration into the category of RF microneedling devices. And what I discovered was that the Morpheus 8 is an effective treatment, but the problem is it is a very deep penetrating device, and a lot of people are using it for skin tightening purposes. And the problem is the skin is very thin, it's about 2 millimeters, and this device goes between 4 to 8 millimeters, and what's below the skin, it's fat. And fat, as we all know, is a very valuable part of the youthful look, and the unfortunate problem is when you penetrate to that level, you could injure that fat level. And quite honestly, you cannot achieve long-lasting tightening with any device that's currently out on the market. So why take that risk? That's my general opposition to the Morpheus 8, and that's why I chose to go with a more superficial device. So a common question that comes up all the time is, how long does the fat transfer last? See, the reality is most of us are used to using fillers, which are temporary. You got to remember, a filler is basically a man-made product that is put into our face, and it breaks down with time the second it goes in. Our immune system and our body wants to get rid of it. Fat, on the other hand, comes from our own body, and as a result of that, it functions as a graft. In the same way that hair grafts work, the way the cartilage grafts work in reconstructive rhinoplasty surgery, bone grafts, cardiac vessel grafts, all these different things. Our bodies are used to things moving from one place to another and then establishing it as a permanent part of its natural anatomy. And that's the way we use the fat transfer for. It basically is a fat graft. So what we do is we take it from a different part of the body, transfer it to the face, and then once it's in there, the local tissues create a process called neovascular genesis. It's a cool name for basically new blood vessel formation. And once those blood vessels feed the fat grafts, that fat then becomes integrated into the local tissue, and it's there for good. And what's really, really interesting here is that unlike facial fat or fat on the hands that dissipate with age, the fat that the donor sites are used for, which is the stomach or the thighs, those fat sources are there for life. They don't go down with time. They don't disappear with time. So we use that differential physiology to then use that fat as a donor dominant source and then have permanent fat in the face. So the simple answer to that very important question is that fat transfer, if it's done in a proper way, is a permanent solution. But I emphasize proper because there's a lot of different ways that fat transfer can go wrong, from the way it's harvested to the way it's processed to the way it's injected to the volumes that are injected, and that's where expertise in fat transfer comes very, very important. And for me, that's always been a part of my practice for the last 15 years. I've done over 5,000 cases, and we've had very, very beautiful success with that and very consistent and reliable outcomes. So I hope that answers a very important question, a very common question that comes up all the time. Thanks so much. And if you want any other questions answered, make sure you comment on the section below, and we'll make sure that we get to those as this frequently answered question section. And please don't forget to subscribe to the channel. Thanks so much.